So yes, there are countries in Europe for which there are epidemiological data about the prevalence of obstructive sleep apnea. But there are other countries where there is no such studies. So the main author of this paper, Adam Benjafield, studied the demographic profile of these countries according to the age, sex, BMI and race. And then he looked for epidemiological data on sleep apnea from neighboring countries and adapted the result according to the demographic profiles of these countries. So sleep apnea represents an important burden for the healthcare system because there are many people that need diagnosis and treatment. So I think we will have to have new ways to treat and to diagnose sleep apnea patients that are easier than the one that we currently have. So to conduct an epidemiological study to assess the prevalence of a disease is very complicated because you need to randomly select the participants from the general population. You cannot just take people who complain of sleepiness or snoring because it would induce a selection bias. So it's very difficult to select the right people to have a representative sample of the general population, and this makes these studies very complicated. So as you know, respiratory events during the night generate many awakenings, so it disturbs the quality of sleep and it generates daytime sleepiness. People tend to fall asleep during the day. Untreated sleep apnea is associated with a 7-fold increase in the risk of car accident, for example. Many studies have also shown that untreated sleep apnea, especially severe sleep apnea, tends to be associated with increased risk of stroke and hypertension and maybe other cardiovascular disease. So usually it's the bed partner who really detects the respiratory events like apnea, loud snoring stops and resumes. But for people who sleep alone, it's more complicated. So usually when they feel very tired, very sleepy during the day, and they know that they are snoring during the night, they should seek help and consult their general practitioner. They can also use the NOSAS score. It's a NOSAS score. There's an app where you just enter your age, sex, BMI, neck circumference, and whether you snore or not, and they will tell you if you're at risk or not for sleep apnea. And there is a free app for Android and iPhone systems.